Hello, welcome to today's video, Importance of Wearing a Nose Mask as You Go Out. A few months ago, it may have seemed silly to wear a face mask during a trip to the grocery store. And in fact, the mainline public health message in the US from the Centers for Disease Control and Prevention has been that most people don't need to wear masks. But as cases of the coronavirus there's new thinking about the benefits that masks could offer in slowing the spread. The CDC says it is now reviewing its policy and may be considering a recommendation to encourage broader use. I can tell you that the data and this issue of whether it's going to contribute to prevention are being aggressively reviewed as we speak, Redfield told NPR. And Tuesday, President Trump weighed in suggesting people may want to wear scarves. "I would say do it," he said, noting that masks are needed for health care workers. "You can use scarves, you can use something else," he said. On Tuesday, Dr. Deborah Birx, who serves as the White House's coronavirus response coordinator, said the task force is still discussing whether to change to the recommendation on masks. Other prominent public health experts have been raising this issue in recent days. Wearing a mask is an additional layer of protection for those who have to go out, former FDA Commissioner Scott Gottlieb told NPR in an interview. "It's a step you can take, on top of washing your hands and avoiding gatherings." Face masks will be most effective at slowing the spread of SARS-CoV-2 if they are widely used, because they may help prevent people who are asymptomatically infected from transmitting the disease unknowingly. Gottlieb points to South Korea and Hong Kong, two places that were shown to manage their outbreaks successfully and where face masks are used widely. A prominent public health leader in China also argues for the widespread use of masks in public. The Director General of the Chinese Center for Disease Control and Prevention, George Gao, told Science that the US and Europe are making a big mistake with people not wearing masks during this pandemic. Specifically, he said, mask use helps tamp down the risk presented by people who may be infected but aren't yet showing symptoms. If those people wear masks, it can prevent droplets that carry the virus from escaping and infecting others. The argument for broadening the use of face masks is based on what scientists have learned about asymptomatic spread during this pandemic. It turns out that many people who are infected with the virus have no symptoms, or only mild symptoms. What this means is that there's no good way to know who's infected. If you're trying to be responsible when you go out in public, you may not even know that you're sick and may be inadvertently shedding the virus every time you talk with someone, such as a grocery store clerk. If these asymptomatic people could wear face masks, then it could be helpful to reduce the transmission in the community. Given the reality of asymptomatic spread, masks may be a good socially responsible insurance policy. Wearing masks protects other people from getting sick from you. But there is still a big concern about mask shortages in the United States. A survey released Friday from the U.S. Conference of Mayors finds that about 92% of 213 cities did not have an adequate supply of face masks for first responders and medical personnel. And supplies are also tight for surgical masks, the masks used everywhere from dentists' offices to nail salons and that are even handcrafted. We need to be very mindful that the supply chain for masks is extremely limited right now, so you really don't want to pull any kind of medical masks out of the system. Where does that leave us? Some research has shown that cotton t-shirt material and tea towels might help block respiratory droplets emitting from sick people, even if the effect is minimal. But experts say homemade masks may not be effective if not constructed and handled properly. That's why Gottlieb says the CDC should issue guidelines advising people on how to construct their own cotton masks. Cotton masks constructed in a proper way should provide a reasonable degree of protection from people being able to transmit the virus. Randomized clinical trials have not shown significant effects for hand hygiene either. But for mechanistic reasons, we believe hygiene can be a good way to kill pathogens, and WHO still recommends hand hygiene. And those randomized studies were looking at how the face mask could protect the wearer, but what experts are arguing is that face masks may prevent infected but asymptomatic people from transmitting the virus to others. It's hard to come by data on this point. One meta-analysis reviewing mask use during the SARS epidemic found that wearing masks, in addition to other efforts to block transmission, including hand washing, was beneficial. Another meta-analysis of masks used to prevent influenza transmission was not conclusive but showed masks possibly help. Concern over presymptomatic spread in the community has also led some hospitals to change their policies and extend the use of masks to non-clinical employees and visitors. Last week, Massachusetts General Hospital in Boston took the unusual step of giving surgical or procedural face masks to all employees who go into the hospital to work, even if they don't provide care to patients. On March 29, the University of California, San Francisco, also started giving surgical masks to all staff, faculty, trainees, and visitors before they enter any clinical care building within the UCSF system. If people do start wearing face masks regularly in public, it is important to wear them properly. She notes that the World Health Organization has a video on how to practice correct hygiene when putting on or taking off a mask. An infectious disease researcher and biodefense consultant are skeptical that healthy members of the public need to start wearing masks regularly. People should follow current CDC guidelines. But we emphasize that if you are going to wear a mask, you have to wear it appropriately. That means, you have to discard it when it gets damp or moist. You want to stop touching the front of it. Don't reach under to scratch your nose or mouth. Otherwise, wearing masks could give a false sense of security. Please check on our next video. We'll mention how to avoid arguments or divorce with your spouse as you stay home. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.